This is Dr. Venugopal, pediatrician from OM Hospital. Today I want to briefly discuss about cough in children. Many parents will have query, is it to worry? I will simplify it. For dry cough, generally it will cause because of viral infections, asthma or some cold weather. Wet cough, generally it will indicate some kind of infections, especially viral infections in children less than 3 years. That condition is called bronchiolitis. And about night cough, generally after sleeping they will get cough, especially sometimes postnasal drip or asthma. Sometimes gastroesophageal reflux disease also can cause night cough. Sudden onset cough, especially children less than 3 to 5 years, it could be foreign body. What to be done in cough? Better to hydrate the child well and use saline nasal drops and steam inhalation. Avoid over the counter medications and adult cough syrups. Avoid unnecessary antibiotics. And you can visit pediatrician if cough is causing so much problems to the child and if it is associated with fever and persisting for more than 3 to 5 days and cough itself if it is persisting for more than 2 weeks, better to visit pediatrician. Thank you.